This is Dr. Din, board certified dermatologist, and this is our next episode of DC Dermatology Skin Truths. Today, we are going to be walking through the journey of being a dermatologist as well as being a PA in dermatology. So I have today our PA, Nina Reynolds.
Hi.
So welcome, Nina. Thank you for being on the
Thank you for
podcast
having
today.
me. I'm so excited.
So just a little bit about yourself. How long have you been doing cosmetic dermatology?
Yes, so I have been working as a PA in cosmetic dermatology for the past 7 years now.
Oh, awesome.
Yeah.
Very good. So what first made you interested in the field of dermatology?
You know, it was probably right after I graduated from undergrad. I started working at a dermatology office with a bunch of other PAs, medical assistants, doctors, and I realized I really loved it, both medical and cosmetic. I think if honestly I hadn't gotten into that job right after I graduated, I wouldn't know how much I loved it. My next question for you, when you were in med school, what activities or research opportunities did you participate in to help you learn more about dermatology, if you did any?
What helped me with understanding dermatology was joining the clubs. So at our medical school, we did have a derm interest club. So it allowed us to meet dermatologists, get some advice about the whole process, and then we did have a residency associated with the school. And I think what was important was really getting to know the residents and joining in on their grand rounds. So in dermatology, grand rounds are very important because there's special cases that when you just see one physician, it may be a complicated case where you need the opinions of other physicians. So grand rounds, that whole process is great and allowed us as medical students to experience dermatology, but at the same time also meet different dermatologists and dermatology residents.
And this is in didactics.
Yeah, this
So
is
this is to help you also make the decision if you even like this.
Correct.
Great.
Because with medicine, as a physician, once you pick your residency and you complete it, you're kind of stuck in that field. So you want to know if you like it before you commit to another 4 years of learning. Can you review your timeline to dermatology? So, starting from undergrad and beyond as a physician assistant.
Yeah, absolutely. So I went to UCLA for 4 years, did undergraduate there, and got my degree in psychobiology, which is basically just psych and bio classes. And then I worked as a medical assistant at that derm office in Los Angeles for about 4 years. I applied to PA school twice and got in the second round. And so I went to PA school at Touro University, the California school, because they have a few throughout the United States. That was a 3-year program. And then after I graduated from Touro, I went straight into aesthetics. So I started working at another med spa for about 5 years, specializing in injectables, lasers, things like that. And then I came here.
Very nice. Do you feel like it's very common to have to go through application rounds for PA school more than once?
Typically, yes and no. So in my specific situation, I kind of knew exactly what was my downfall the first time around. I had pending classes. So when I talked to a lot of pre-PAs and things like that, and they're having me look at their resume, look at their application, I say, if you have anything pending, wait until you have a full, complete application, only because they're trying to find ways to kind of weed you out or weed out and narrow down, because there's so many people applying to PA schools now. So if there's anything that's like incomplete or in progress, they're gonna be like, well, we have a person here who has it complete, like we're gonna disregard. So I'm pretty sure that's why I didn't get in the first time around. But it is common. I've had friends who get in on the first try. I've had classmates who it's their third or fourth time applying. So it does vary, just depending, yeah.
Yeah, I completely agree with that too, because even in medical school, at least with my colleagues and in this new stage of students applying for medical school, it is pretty common to not get in the first time. I mean, my journey was I went to University of Delaware. I was a biology major, so I did 4 years there, and then I took a break for 2 years just because I wasn't really ready to maybe apply for medical school at that time, like emotionally or mentally prepared to do all that schooling because it's 4 years. So I took a 2-year break, and then I got into Western Universities. That's out in Pomona. And from there, you do your training, you do your didactic classes, which is 2 years of that, and then 2 years of medical rotations. And then after that, you have to match into dermatology. So it's a whole process. So you get a lot of your experience through the third and fourth year of medical school. You have to do all your board exams, which are like 8 hours long each time. And then when you match into dermatology, you actually do what they call a transitional year, which is like a overall intern of the hospital. So think of it as like Grey's Anatomy, but for internal medicine. You're kind of the lowest man on the totem pole. You're going into the hospital. You're seeing all these different types of patients, doing all these different like exposure to medical specialties, not just dermatology, but really mainly like internal medicine, primary care, surgery, things of that sort. And then you start your dermatology residency a year after your intern year, and that's a 3 year program. So throughout the 3 years, then you start really specializing in the field of dermatology where all you see is mainly just dermatology. I did like the fact that they had the intern year, even though it was a lot of work and a lot of late nights and overnights at the hospital, because you get a lot of experience in the different specialties of medicine. And you end up seeing that there's quite a bit of overlap in certain fields with dermatology. So it does help with the education.
Where did you do your residency?
I did it at Lehigh Valley out in Allentown, Pennsylvania, which I loved. I love that program, and I think it's a great program. So for all the med students who are thinking about dermatology residency, Lehigh Valley is a great one.
And how long from like starting med school to completing residency? Like how long does that, like how many years was that?
So you do 4 years med school,
Right.
1 year transitional year, and then 3 years derm. So total of 8 years.
Okay, that's what I thought.
Yes.
But great.
Yes. So it is a lot of
a lot.
It's a lot of steps.
Med school. Yeah.
And it's very, I think with medical school and dermatology residency for physicians, it's very structured. So you just got to get into residency, which is the hardest part.
Right.
What I see with a lot of PA students is when they want to get into dermatology, it can vary so much. So I think this is why we did this podcast, because we do have a lot of PA students who are interested in dermatology and they want to get experience and exposure, but they don't know how to do that.
Right.
And I think it varies too.
It does,
Like your
yeah.
story is going to be different than a different PA who's doing dermatology.
Totally. Yeah.
Did you do any work in other specialties after PA school?
You know what? I did not. I did do some shadowing just to kind of boost my application, boost my PA school application. So I did some shadowing with a pediatrician and I think maybe a primary care doctor, but I was medical assisting for 4 years at that very busy dermatology practice, which was great because they did medical and cosmetic as well. So we were doing Mohs and Botox and skin checks. So it was a little bit of everything, and I loved it all. So that was really my main thing post undergrad. Were you torn between another specialty, or was it always derm for you?
I did join a couple interest groups. I
Oh,
do
tell me more.
remember
Okay.
I liked pediatrics.
Okay.
And
I like peds too.
yes, I did. I liked pediatrics. And then I liked dermatology. And I think at one point I liked surgery. I don't know why, but
Well, there's hands-on. This
Correct.
is why I like aesthetics
Yes.
and derm, is because there is a hands-on component. I don't want to be writing scripts all day. Like I want to be doing a procedure. So that's probably why I like surgery too, because obviously that's all hands-on.
Correct.
Yeah.
Yes. And it wasn't just like general surgery. It was more
Yeah.
like I liked maybe plastic surgery. I thought that was a really interesting field.
Right.
So
Related.
So with derm, there is a lot of overlap with plastic surgery, and you do work with plastic surgeons pretty frequently.
Love that. Great. So that was what I was going to ask you next. How did you end up deciding derm then over peds, over surgery?
I really liked the variety. And sometimes it feels like it's two different worlds, because I could
Yeah.
be seeing a patient for a skin check to make sure they don't have melanoma, looking for skin cancers. And then in the next hour, I could be doing a consultation for a cosmetic patient. So there's so much variety in dermatology. The lifestyle is good too, in the sense of there's not really many dermatology emergencies. I mean, that's not why I picked it solely, but I think it was something that I value and enjoy. But really, it was being able to treat skin cancers, also treat cosmetic concerns, also treat pediatric patients, also do surgeries. I love the variety.
I think that's a good point to bring up, though, is the like no one's going to die on your watch type thing, because quality of life is like so important, especially with the PA route. A lot of people end up going the PA route, they say, for quality of life, shorter amount of school, shorter amount of loans, a more flexible schedule because you have a doctor overseeing you. So that was another big factor as to why I specifically wanted to go into derm as well, not just PA, because the quality of life there is even more so. The hours are better, the more flexible, etc. Yeah.
So, Nina, tell me, what does a typical day look like for you when you're doing cosmetic dermatology?
Okay. Well, it's nice, like what you were saying. It's the variety. So a lot of injectables, Botox, Dysport, filler, Sculptra, all of those great, fantastic injectable treatments. Also, some nice rejuvenating treatments. So, microneedling, picosecond laser, Eligio X, which is the new RF tightening that we have, and then some chemical peels, acne consults. It's a variety. And I never really know what it's going to be, especially here. It's a really big variety of clientele and 9 to 5 type job. Here I'm right now working about 2 days a month, and it's been great.
I would say that for me, a typical day can be different based on what the office is, which office I'm at. So for DC dermatology, a lot of it's cosmetic. I still do some medical dermatology here where we do skin checks, looking for skin cancer, diagnosing rashes and treating that. And then in my skin cancer clinic, it is predominantly just like tons of skin cancer, excisions, and a little bit more of a faster paced environment.
So far, what would you say has been a career highlight for you?
I think a big career highlight for me was opening up DC
I was going
dermatology.
to say, that would be mine for you too. I
Yes.
would imagine.
I think it came at a time where I felt ready to do something like this. And I felt ready to be a part of this community in Fountain Valley. Um, so I thought it was very exciting. It was nerve wracking also, opening up a business, and it's my first time doing it. So
You also happened to be pregnant. So she
yes.
was also, how many months pregnant were you when we did the opening?
Let's see, my baby
You were like
was due in
halfway.
October, so I was halfway there. I was in my second trimester.
I wouldn't have known though. Had you not told me, I'd be like, oh, she's just crushing it, open her own practice. And yeah, just happened to be pregnant with her second. So
People did think I was crazy.
yeah.
And even my OB-GYN and other doctors were like,
Are you sure?
"Are you sure this is?" But I was like, "Well, I'm all already in it. I
You were
can't get out of it now."
you were very calm, cool, and collected though. I never really got the vibe, and maybe you were hiding from me, that you were like overwhelmed, stressed out. Like I was like, I can't, I'm pregnant right now. Like
Yes,
I would
congrats to
not be
Nina.
in the same mental state as you were last year. But it was great. Like you really did it, and I wouldn't have even known that like you were also starting, making your family bigger.
Yes,
So it was great.
growing our family and growing the business, that was all the
All
things that were happening
simultaneously.
all at the same
Yeah.
time. What about you, Nina? What has been a career highlight for you?
You know, I think so after I graduated PA school, I worked at my first aesthetics job. It was a great learning experience. I was there for 5 years. I really was like so busy, learned so much, but I think I was being like really run down. I really wanted to jump into injectables more. And I was kind of like, okay, at this 5 year mark, I just had my first baby. Am I going to like stay here for the rest of my life, or am I going to like make moves and do something, with even better quality of life, better pay, things like that. And so starting here and my other job, doing this full time has been, I think, the highlight, just because I can really see my quality of life and balance with between family and work. Like I love coming to work. I feel like I have plenty of time spent with at home with my, husband, with my baby. So it's not like, I guess, a single moment, but just starting working here, after I finished my 5 years, kind of like in the trenches, is how I felt. I felt like that was a big accomplishment. I always say, like, the job that you chose next, like every job that you get after like the first one, should always be like a better job in one sense or another. And it felt like that. Yeah.
Very nice. Very nice.
Okay. For my pre PA students, I think the number one thing is even if you can't get a job physically in derm or aesthetics for whatever reason, like there's nothing available, you're applying, there's nothing, do your best to try and at least shadow a derm PA or MD in aesthetics or medical derm and get some shadowing experience, get some shadowing hours. I think being able, like you were saying with those ground rounds, to like go and see what an actual day looks like for somebody like who you want to be and making sure that you actually like it is great. I mean, of course, getting like a medical assisting, scribe, phlebotomy, even front desk job in derm or aesthetics as a pre PA or PA student is also great. Um, but something, just like get your foot in, make a connection, find somebody, DM somebody on Instagram, find somebody on LinkedIn, and see if you can just like ask them a few questions, shadow their day if you can't work with them directly. That would be my number one. Number two is if you're in PA school currently and you have no derm experience or have didn't do that, it's fine, but you want to be or you think you want to be, trying and getting the clinical rotation in plastics or in derm, medical or cosmetic, if they offer one at your program, or trying to set one up somehow. I know that's a little bit more difficult or challenging too. But again, for the same reason is okay, well, if you're going to go and do it, like you want to make sure that you actually like it. Like you want to see what a day to day looks like and see if you like the injectables or like looking at the rashes, like doing the mole removals and see if that actually is something that entertains you. And then this is actually, I think, really important for once you graduate, because I get a lot of PAs who are already PAs and they're like, how do I get into aesthetics? I'm in urgent care, I'm in ER, but I want to be. I think for me, the biggest the not the easiest, but I think a big thing is if you know you want to be in aesthetics, even at some point, you go and do even like 1 day a week, 1 day a month, work in aesthetics right from the get go, or like work in derm right from the get go, because I have a lot of friends who are like, oh yeah, I want to do derm, but like I'm gonna do ER for a few years and then jump into that later on, and that's fine. But what happens is, or what I've seen happen with classmates and friends and things like that, is they'll go and do ER, go do primary care, whatever. It's like 5 years in, they're making a great salary, and they're like, okay, I'm ready to go and do derm or do aesthetics and be more chill. And it's like you're literally starting from square one. You end up starting at a new grad job getting paid way less than what you are, and now that it's like not as like exciting or enticing because you're like 5 years senior at another specialty. So even if it's 1 day a week or 2 days a month, whatever, trying to find like a med spa or a derm that like offers weekends and you can work a couple shifts. That way, when you are ready to transition full time, you can be like, I have X amount of years of experience, even though it hasn't been full time. I think that that is the easiest way to transition. Um, yeah, those are my three. Is that three? Did I give three? I think it was two.
Yes. I 100% agree, and I do think it is challenging for the PAs that have already graduated and they want to do derm, because at least in my experience when we were hiring for PAs, it depends on the office, right? If the office is doing predominantly medical and surgical dermatology and they're looking for a PA, they really need someone that knows a good basic knowledge bank of medical and surgical dermatology. So reading about that, being exposed to that when you're in PA school is really important. And then the supervising physician also needs to be invested in the PA's just general knowledge base and teaching, and then also giving insight and really doing a good job supervising the PA so they can excel in their role. And if they choose to leave later on, the PA that is, they can excel in the next dermatology job. So I think the role as a physician when you're taking on PAs is to really see if you have the time to commit to teaching, to giving feedback, and to encourage just education in the field of dermatology, because if it's a medical or surgical dermatology practice, you're going to be coming into a lot of complex cases. Versus with cosmetics, the experience can vary, certainly. Same idea though, whoever the supervising physician is also needs to put in the effort as well to teach and to guide a new PA who's learning about this field. Because one, for the safety of the patient, and then two, for the growth and betterment of the PA. So, like you said, you didn't stay at the one place the whole time. You ended up going to different places. And so, your experience, like when it's positive and you're learning a lot, you end up being even better and going into the next job, knowing your value and knowing what you can bring to the practice. I think for medical students who are interested in doing dermatology as a residency, one a piece of advice is when you are doing your rotational years, which is your third and fourth year, even though you know you want to do dermatology, don't ignore the other specialties that you're in. You're going to be in those rotations for a month, and you should learn as much as you can about those fields, because you'll see that for medical dermatology and even surgical dermatology, there's overlap in a lot of these fields. So, pediatrics, there's a big overlap with dermatology, immunology, plastic surgery, endocrinology. Like, I could name so many things that skin diseases are manifesting because of some internal situation that's going on. So pay attention, be diligent still. Don't just write this off as, well, I don't even like OB-GYN, then why? I don't even care, I just want to do derm. But even in OB-GYN, you're going to see dermatology changes on the skin in pregnant women, and acne, how are you going to deal with that? Because it's going to be different than a patient who's not pregnant that you're treating for acne. Number two would be to read, because in medical school, yes, you do a lot of learning, you do a lot of exams, but dermatology is only taught for maybe a week or 2 weeks. A very short period of time is dedicated to dermatology education in medical school. And so reading on the side, if you have time, is really important. I personally like Andrew's Diseases of the Skin. It's one thick textbook, but it has great pictures and great treatment plans. So reading is really important. And when you go into your rotation in dermatology, and this could be an elective, then that's when you really are picking up how a day is like with that specific dermatologist that you're working with that time. And then lastly, be open-minded to just the field of dermatology as a whole, because it's always changing. There's going to be new recommendations. There's going to be new information coming through the pipeline for medical dermatology, surgical dermatology, and especially with cosmetic dermatology. There's so many different injectables that are out there. And I think just being open-minded and always feeling like, even though you're done with residency, you always want to keep learning. And that's really important. And I think in any field of medicine, is to not feel like you know it all, but to come into it saying, I know a good amount, but there's going to be cases that are complex, and there's probably new treatments on the horizon that are coming down the pipeline to be aware of.
Fantastic.
Yeah.
I agree. The extra reading on, or even extra education, the CMEs and all that with aesthetics. There's one that I did, especially when I wanted to get into injectables. It's Palette, Palettte, and they'll do like a didactic, and then you bring a patient, and you can do like training hands-on injection with them. And a lot of these can be a little bit more expensive and things like that, but if and when you can, especially if you aren't working full time in aesthetics yet, those are also really helpful too.
And I think for both groups, PA students and medical students, exposure to dermatology, like what you emphasize, is very important, whether it be through meeting a dermatologist or a derm PA that is willing to mentor you and really walk you through the process, and giving you very honest feedback about the journey. And then grand rounds, if you're at a medical school that has a dermatology residency, you should go to grand rounds. You're going to learn a lot, and you're going to meet a lot of people. And then I think with the PAs, like you said, getting exposure through different programs, because there is no PA dermatology residency.
Right.
You kind of have to make it yourself.
Uh-huh.
And each PA is going to have their own journey. This happens to be Nina's journey, and it worked out wonderfully for her. But I think other PAs are trying, and it can be really difficult if the opportunities are not there.
Right.
So sometimes you have to make the
You have
opportunities.
to make it. Yeah, truly. Yeah. I agree with that 100%.
Thank you so much, Nina, for being here and answering these questions. I hope that you found it to be very educational and helpful for your journey into dermatology.
If you're interested in following along, my journey. My Instagram is at Skin by Nina.
If you enjoyed today's episode, please subscribe, leave a review, and share the podcast with someone who might find it helpful. This podcast is intended for educational and informational purposes only. It is not meant to replace medical advice, diagnosis, or treatment from your own healthcare provider. For additional science-based dermatology information, visit aad.org. To learn more about our dermatology practice, visit www.dindermatology.com.